Modern medicine has significantly transformed humanity. The evolution of healthcare, ethics in medical practices, and newer modalities of treatment have contributed towards increasing human lifespan and enhancing the quality of life. But this wasn't always the case. Medicine is a field constantly striving to use the newest technologies and techniques to help improve the health of the masses. But back in the day, the medical sciences were in their primitive forms. Physicians did not have enough knowledge or understanding of the human body and its pathologies. This meant devising treatments and cures was more of a hit-and-trial process. Superstition, religious beliefs, astrology, and even magic influenced medical practices. The ancient people had found effective remedies for many conditions, but some of their treatments and practices were quite unscientific, harmful, and downright barbaric. The poor understanding of disease and the body led to the prevalence of these horrifying practices for hundreds of years until they were finally abolished. Some of these bizarre treatments were used well into the 19th century. Many suffered and even died because of these unscientific and disastrous rituals. Here are 15 dangerous medical practices of antiquity. Number 1. Raw veal and badger dung for rabies. Believe it or not, the ancient Romans actually used raw veal to treat rabies. For them, it was a frightful but not necessarily fatal kind of madness. Modern-day physicians know that rabies is actually a viral disease that causes encephalitis in humans and other mammals. Historically, it was referred to as hydrophobia because of the symptom of extreme panic in the diseased when presented with liquids to drink. It begins with fever and tingling at the site of exposure, followed by symptoms including nausea, vomiting, violent movements, uncontrolled excitement, fear of water, inability, confusion, and loss of consciousness. Once the symptoms appear, the result is virtually always death, regardless of treatment. It is spread when an infected animal bites or even scratches another animal or human. Exposure to the saliva of an infected animal or person can also transmit the infection. Ancient Romans are infamous for their innovations, and medicine was no exception to that. The Roman physicians believed that they had found a cure for rabies. According to them, raw veal and badger dung was the answer. If a person was bitten by a rabid animal, the physicians would treat the wound by wrapping it in raw veal. Along with that, the patient was fed a mixture of hog fat and lime. They also made the patient wash this terrible mixture down with a special medicine that was made from boiler badger dung and wine. This medicine was supposed to cleanse their system. This insane treatment was actually useless for anyone who had been infected with rabies. It also posed the risk of the wound site and gastrointestinal infections. However, the patient infected with rabies probably never lived long enough for that to happen. 2. Horrifying enema. An enema, historically known as a clyster, is an injection of fluid into the lower bowel by the way of the rectum. While the modern version is safe, painless, and non-infective, it wasn't always like that. In standard medicine, enemas are frequently used to relieve constipation and for bowel cleansing before a medical procedure or examination. The first ever mention of enema in medical literature was found in the ancient Egyptian Ebers papyrus, dating back to 1550 BCE. According to Egyptian mythology, the god Thoth invented the enema. During medieval times, enemas were performed using devices called clysters. A clyster was a long metal tube with a cup attached to the end. The tube would be pushed inside the body through the anus, and a medicinal fluid was poured into the cup. The fluid would then be introduced into the patient's colon by performing a series of pumping actions. Now, in modern medicine, warm and soapy water is used for this purpose, but back then, things were a little bit more earthy. One of the most popular fluids that found its way into a clyster was a concoction of boar's bile. In 1753, an enema bag was prepared using a pig's or beef's bladder attached to a tube that Johann Voits described as an alternative to a syringe. Later in the 18th century, Europeans adopted tobacco smoke enemas, which the indigenous peoples of North America used to resuscitate drowned people. The tobacco resuscitation kits included a pair of bellows and a tube. These enemas came as a cure for headaches, respiratory failure, colds, hernias, abdominal cramps, typhoid fever, and cholera outbreaks. Number 3. Corpse medicine. Corpse medicine or medical cannibalism is the consumption or use of the human body, dead or alive, to treat diseases. Back in the day, the medical and pharmacological use of human body parts became normal due to the belief that because the human body could heal itself, it could also help heal another human body. This belief was shared among different cultures, including ancient Mesopotamia, Egypt, Greece, China, and the Judaic culture. If you were prone to headaches, muscle cramps, or stomach ulcers in ancient times, the physicians would give you a dose of the so-called corpse medicine. This was actually a combination of human flesh, blood, or bone. Medical cannibalism in Europe can be traced back to the ancient Roman Empire in the 2nd century AD. Marsilio Ficino, a 15th century philosopher, wrote that the Romans drank the blood of slain gladiators to absorb the vitality of strong young men. Medical cannibalism peaked in Europe during the 16th century, with the practice becoming widespread in Germany, France, Italy, and England. As recently as the 17th century, King Charles II of England was known for consuming a brew known as King's Drops, which was made using crumbled human skulls and alcohol. Most raw materials for this medical cannibalism were extracted from Egyptian mummies that were stolen from their tombs. Skulls were taken from Irish burial sites. Medicines produced using human bones, blood, and fat were thought to treat several different illnesses. Tinctures were produced by soaking mummified bodies in vinegar or alcohol in order to treat internal bleeding. Powdered skills were used to test ailments of the head. It was also sometimes mixed with chocolate to treat apoplexy. The English also treated epilepsy by mixing skull powder with molasses. Human fat was also used as a topical cure for treating outer body problems. It was rubbed directly on the skin, or the bandage was soaked in fat and then applied to the wounds. Number 4. The whirling chair for mentally ill. During medieval times, mental illness was mostly perceived as possession by a demon or other evil forces. Many of the reagents for mental illnesses were therefore heinous forms of torture perpetrated on people who were vulnerable and too sick to protest. People in those times believed mental illness was caused by ill humor, imbalances of the blood, evil forces, or congestion of the brain. One incredibly painful treatment method for mental disorders was inspired by the work of the eccentric Erasmus Darwin, the grandfather of the infamous Charles Darwin. This is known as rotational therapy and was implemented using one of two methods. An ordinary chair was suspended from the ceiling with ropes attached to the legs. The diseased person was strapped in this chair, and the ropes were used to spin it until it was set in motion. In the other method, a pole was fixed from the floor to the ceiling using iron rods. It had a horizontal arm attached to it. This arm was used for hanging a chair or bed and for spinning the patient. The basis behind Darwin's theories about this treatment wasn't reliable. He observed children spinning themselves to induce vertigo. As a result, they would laugh and fall down. This struck him as a helpful state to induce in the mentally ill. The patients were spun in a circular motion until they promised to obey the doctors and get better. Once they committed, the doctors would release them and allow them to sleep and recover. As expected, once the shock wore off, the patients were still mentally ill, which meant going through the procedure again. 5. Trepanation. Also called trepanning or trefining, this bizarre surgical procedure was used in the past as a treatment for various health problems related to intracranial diseases. In this surgical intervention, a hole was drilled or scraped into the human skull. This intentional perforation of the cranium exposed the dura mater. This was also done in order to release pressured blood buildup from an injury. In ancient times, holes were drilled into a person who was behaving in a manner that was considered abnormal. People back then thought this was a way to let our evil spirits that were causing the symptoms. Evidence of trepanation has been found even in prehistoric human remains from the Neolithic times and onward. The bone that usually trepanned was kept by the prehistoric people who allegedly wore it as a charm to ward off evil spirits. Archaeological evidence also suggests that this procedure was a sort of emergency surgery performed after head wounds to remove shattered bits of bone from a fractured skull. The blood that pooled under the skull after the injury was also extracted using this technique. Evidence shows that trepanation was most commonly practiced in areas where weapons that could produce skull fractures were used. The primary theories for this practice in olden times include spiritual reasons, treatment for epilepsy, head wounds, mental disorders, and headaches. This is perhaps the oldest surgical procedure for which archaeological evidence is available. Almost 1,500 tree-find skulls dating back to the Neolithic period have been discovered across the world. Most of these crania belong to males, however. Women and children were also represented. Number 6. Dead mice for tooth pain. Ancient Egyptians are known for their immense knowledge and futuristic concepts and practices. While they were onto something in subjects like geometry, engineering, and chemistry, their understanding of medicine was vastly different from what we see today. Because of their geographic position and climate, the grains of sand were often mixed into their diet. The ancient Egyptians, who often used to bite on grains of sand, would suffer from severe toothache sometimes. After pondering on this issue, the Egyptian physicians concluded that dead mice were the cure for this toothache. They used to mash dead mice and other substances into a paste and directly applied it to the painful teeth or gums. If the toothache was too severe, an entire dead rat would be stuffed into the patient's mouth. However, ancient Egyptians weren't the only people to indulge in this practice, because this type of treatment with a fractional spectrum was also once used in rural England during the 1920s. No one can say for sure how effective this treatment was, but anyone who hears about it nowadays definitely feels nauseous by the thought of stuffing an entire mouse in one's mouth. Another misconception during ancient times was that toothaches were caused by worms living inside of teeth. This assumption led to the development of many terrifying treatments, including the use of maggots or caterpillars, a concoction of spiders, eggshells, and oil called spider juice, and the brain juice of a dead rabbit. Number 7. Xenotransplantation. Transplantation has been a challenging feat to achieve even in the 21st century, so it's only natural that scientists and physicians from the past didn't have much success with it. Their first thought wasn't to transplant human organs into other humans. In fact, they began with transplanting animal organs into humans. This is called xenotransplantation and has been considered an appealing solution for organ shortage for a long time now. The idea behind this procedure dates back to 1667, when French doctor Jean-Baptiste Denis tapped the veins of farm animals to perform human blood transfusions. His first-ever patient, a 15-year-old boy, miraculously survived because he was given only a small amount of sheep blood. He was able to withstand the allergic reactions. But after the next 2 patients died from this, the practice was banned. In the 19th century, skin xenografts became popular, and many surgeons began using species like rabbits, dogs, and pigeons as donors. However, none of the grafts was permanent. In the early 1900s, doctors also attempted to replace failing human organs with organs from animals including pigs, goats, lambs, or monkeys. But all of these xenotransplants were a huge failure, and any further attempts were halted until scientists finally figured out why these transplants had failed. Number 8. Treatments for hemorrhoids. Hemorrhoids are one of the best described diseases in medical history. In fact, disorders of the anus and hemorrhoids have been described in detail from as far back as ancient times in almost all cultures. Hemorrhoids are actually clusters of vascular tissue, smooth muscle, and connective tissue arranged in 3 columns along the anal canal. These are normal structures present in almost all humans, but modern medicine only uses the term for pathologic or symptomatic ones. People suffering from hemorrhoids can experience itching, pain, mucus discharge, and fecal seepage. External hemorrhoids cause extreme pain. The oldest descriptions of hemorrhoids have been found in Mesopotamia, and these date back to 1500 BCE. Records from other cultures, such as Indians and Chinese, also contain even older records. The Egyptian Chester Beatty medical papyruses from 1200 BCE exclusively discussed these diseases. As recently as the 19th century, many believed that hemorrhoids were the male equivalent of menstruation and were equally beneficial. Back in the day when the pathology was poorly understood, people used some gruesome treatments for hemorrhoids. Chinese medical practitioners once used animal bile to treat many illnesses. And for hemorrhoids, they used python bile. In medieval times, surgeons and physicians in Europe treated hemorrhoids by burning them with the help of a blazing hot iron rod. An illustration dating back to the 14th century, held by the institution Bibliothèque Universitaire de Médecine in Montpellier. France shows the process, and even in the illustration, it looks extremely agonizing. Other treatment modalities for hemorrhoids in the past include hot and cold sitz baths, electric currents, radium capsules, leeching and cupping the loins. Number 9, bloodletting. Bloodletting is a process in which blood is withdrawn from the patient in order to cure illnesses or prevent diseases. Back in the day, this was either done by physicians or leeches. It was based on an ancient system of medicine according to which blood and other bodily fluids were considered humors that had to remain in proper balance to maintain good health. Historians claim that it was the most common medical procedure performed by surgeons from antiquity until the late 19th century. For about 2,000 years, this was considered a real scientific method for curing disease. But in reality, for most of the cases during historic times, bloodletting was actually detrimental. Passages from the Ebers Papyrus suggest that bloodletting by scarification was an accepted practice in ancient Egypt. In fact, ancient Egyptian burials have been reported to contain bloodletting instruments. In Greece, it grew popular in the 5th century BC during the lifetime of Hippocrates, who also mentioned this practice. Bleeding a patient to health was actually modeled on the process of menstruation, as Hippocrates believed it purged the women of bad humors. Bloodletting was also religiously supported during the Middle Ages. The Talmud recommended a specific day of the week and days of the month for bloodletting in the Shabbat tractate. Similar rules were also found in Christian writings. During medieval times, bloodletting charts also showed specific bleeding sites on the body in alignment with the planets and zodiac. This means the procedure was also influenced by astrology. Number 10, sulfur fumigation. The ancient Greeks had some pretty colorful ideas about the female body and its internal anatomy. They had this bizarre belief that the uterus of a celibate woman was a completely independent being inside the woman. It was able to detach from its original place in the body and move around anywhere it wanted to go. This, according to the Greek physicians and scientists, produced symptoms such as hysteria seizures and suffocation. The idea prevailed even after doctors learned that the womb is secured in its place by ligaments and could not actually move around. This was called the wandering womb and was conceptualized by a doctor named Zedwade Norden, who published the book Suffocation of the Mother in 1603. However, one description of a wandering womb came from Aretaeus, a physician from Cappadocia. He was a contemporary of Galen in the 2nd century AD and wrote that the uterus could move out of place and float within the body. It was described as like an animal within an animal, or a living thing inside another living thing. To stop the wombs from migrating inside the women's bodies, the physicians emphasized that girls should marry young and bear as many children as possible. If a womb had already started moving, the doctors fumigated the patients' heads using sulfur. They also rubbed lotions with sweet scents between their thighs so that the womb would move away from the unpleasant sulfur smell and towards the aroma to settle back where it belonged. Number 11. Animal dung ointments. Despite having a remarkably well-organized medical system, the ancient Egyptians practiced some incredibly strange methods for treating diseases. They used all kinds of gross things as topical ointments for various conditions. Lizard blood, dead mice, and molded bread were all applied as pastes and dressings on the skins. Women were sometimes dosed with horse saliva in order to cure an impaired libido. One of the most disgusting remedies used by Egyptian physicians included the use of human and animal excrement as a cure-all remedy for diseases and injuries. The Ebers Papyrus from 1500 BCE states that donkey, dog, gazelle, and flea dung were all quite celebrated as ointments due to their healing properties. They also believed that this fecal matter could ward off bad spirits and demons. A series of treatments involving feces was also mentioned in a 1747 book called Pharmacopoeia Universals. The book stated that raven dung, if suspended around the necks of children, could ease their coughs. The pigeon dung could be used for treating disorders like gout, hemicrania, and vertigo if heated violently. The book also stated that 9 pieces of rat dung consumed by a woman could suppress menstruation. Sheep dung was considered effective for treating jaundice, splenic tumors, and warts, whereas peacock dung could cure vertigo and epilepsy. Human dung was useful for curing carbuncled throat infections, wound inflammation, and fever. Number 12. Arsenic. Arsenic is a chemical element that was quite famous during the Victorian era for its medicinal uses. Doctors used arsenic and mercury to treat syphilis before the discovery of penicillin in the 1940s. It was known empirically as a potent medicinal agent as early as 2000 BCE. During ancient times, it was used as both medicine and poison. Orpiment or yellow arsenic and realgar or red arsenic were described as early as the 4th century BC by the Greek philosopher Aristotle. The odorless and tasteless was used for poisoning both royalty and commoners, as it was readily available and cheap. But before modern medicine confirmed that it is highly poisonous and cancerous, arsenic was used as a key pharmaceutical agent too, especially in the ancient Greek and Roman civilizations and traditional Chinese and Indian medicine. Hippocrates is thought to have administered arsenic minerals as escharotics and remedies for ulcers and abscesses. The first book of Chinese traditional medicine, Shen Nong Ben Kao King, also stated the use of trace amounts of arsenic as far back as 200 BC. The Chinese Nanjing Treaty recorded the use of arsenic pills for the treatment of periodic fever. A physician known as China's King of Medicine used a combination of realgar, orpiment, and ATO for treating malaria. Later in 1787, Thomas Fowler, a British physician and pharmacist, used 1% potassium arsenite solution named liquor minerals for treating malaria, remittent fevers, and periodic headaches. Number 13. Tapeworms for weight loss. Weight loss and diets have been of prime importance in human society for many centuries now. One bizarre method for weight loss introduced back in the 1900s would make anyone squeamish, but believe it or not, people actually practiced it. The latest fad diet to lose weight back then was consuming a tapeworm diet. It was majorly advertised by the media and physicians at the time. This trend took off many years after the late opera singer Maria Callas was reported to have lost weight by eating the parasitic worms. But now experts think this was just a rumor. Dieters used to swallow beef tapeworm cysts, usually sold in the form of a pill. It was believed that the tapeworm would reach maturity in the intestines and absorb food. This would lead to weight loss accompanied by diarrhea and vomiting. Once the dieter reached his or her goal weight, they would take an anti-parasitic pill which they thought would kill off the tapeworms. The dead tapeworms would then be excreted. However, what they didn't know back then was that it could cause severe abdominal and rectal complications. It was a risky process, but people were willing to do it anyway. A tapeworm can grow up to 30 feet in length, and they can also cause many health problems, including headaches, eye issues, meningitis, epilepsy, and dementia. Dieting was a booming business during the 19th century, and companies were peddling all kinds of harmful diet products with the help of great advertising campaigns back then. And the tapeworm diet was also sold to thousands in this way without considering the risks it posed. Number 14. Mercury. Mercury is an element notorious for being incredibly toxic. But back in the day, this poisonous substance was commonly used as an elixir and topical medicine. The ancient Persians and Greeks considered it was very useful ointment. 2nd century Chinese alchemists called this prized liquid quicksilver. They believed that red mercury sulfide was able to increase lifespan and vitality. For more than 3,000 years, mercury and its derivatives have been used as anti-parasitic drugs, anti-syphilis, antipruritic antiseptics, anti-inflammatory drugs, dental amalgams, and substitutes. Some healers used to guarantee that by consuming noxious brews containing poisonous substances like mercury, sulfur, and arsenic, their patients could become immortal and walk on water. One of the most famous people who fell victim to this was the Chinese Emperor Qin Shi Huang. He allegedly died after consuming mercury pills that were supposed to make him immortal. In ancient China, mercury was also used as a surgical drug in traditional Chinese medicine. In Europe, mercury and its compounds were increasingly used as medicine in the early 16th century, particularly after their use was advocated by Paracelsus. Between the Renaissance and the early 20th century, mercury was a popular treatment for STDs like syphilis. Some experts used to say that it was helpful in fighting off infections, but the patients often died due to liver and kidney damage caused by mercury poisoning. 15. Eating fecal matter. fecal microbiota transplant, or a stool transplant, is the process of transferring fecal bacteria and other microbes from a healthy person to another individual. In modern medicine, it is considered an effective treatment for Clostridium difficile infection. However, this isn't a recently developed procedure. In fact, it actually dates back to the 4th century. The first use of donor feces as a therapeutic agent for food poisoning and diarrhea was recorded in the Handbook of Emergency Medicine by a Chinese man named Hong Ge. Around 1200 years after the Ming Dynasty physician Li Shizhen used something called yellow soup or golden syrup to treat abdominal diseases. This yellow soup contained fresh, dry, or fermented stool. It was a mixture of fecal matter and water that the patient had to drink. The Bedouins also recommended the consumption of fresh, warm camel feces as a remedy for bacterial dysentery. In modern Western medicine, FMT was first used by Ben Wiseman and his colleagues in 1958. This team of surgeons from Colorado treated 4 critically ill patients suffering from fulminant pseudomembranous colitis using fecal enemas. This resulted in a rapid return to health. Following the success of this experiment, more studies were done on this treatment modality. However, unlike in ancient times, FMT was not carried out by forcing the patients to consume fecal matter.